Question 261. Which medication might be the physician order if the client expresses discomfort with being in the enclosed space of a CT scanner? A. Valium, B. Clorazil, C. Catapres, D. Lasix. Answer A. Explanation. Valium is a sedative that might be given prior to receiving a CT scan. The other medications are not sedatives. Reduction of risk potential. Question 262. Accurate documentation of assessment findings regarding pressure users is very important because A. The law requires the nurse to document lessons. B. The hospital requires the nurse to document lessons. C. The physician requires the nurse to document lessons. D. The nursing assessment of users is a standard of nursing practice. Answer D. Explanation. Documentation of assessments by the nurse promotes continuity of care and helps prevent further progression of the user. Basic care and comfort. Question 263. To ensure proper immobilization and increase client comfort when using a rigid splint, A. Place the client on a stretcher before splinting. B. Place the client on a long spine board before splinting. C. Pad the spaces between the body part and the splint. D. Ensure that the splint conforms to body clips. Answer C. Explanation. To ensure proper immobilization and increase client comfort when using a rigid splint, pad the spaces between the body part and the splint. Basic hand comfort. Question 264. A client has a nasogastric NG tube in place following abdominal surgery. The purpose of this tube immediately following surgery is to A. Simplify medication administration. B. Measure accurate input and output. C. Prevent accumulation of fluids and gas. D. Facilitate collection of specimens. Answer C. Explanation. Immediately post-op abdominal surgery, the NG tube keeps the stomach decompressed to prevent surgical site disruption and fluid loss through vomiting. Basic hand comfort. Question 265. A client receiving drug therapy with furosemide and digitalis requires careful observation and care. In planning care for this client, the nurse should recognize which of the following electrolyte imbalances is most likely to occur. A. Hyperkalemia. B. Hypernatremia. C. Hypokalemia. D. Hypomagnesemia. Answer C. Explanation. Diuretics such as furosemide might deplete serum potassium. Additionally, the action of digitalis might be potentiated by hypokalemia. These drugs are not associated with hyperkalemia. Diuretic therapy could cause hyponatremia, not hypernatremia. Choice 4 is generally associated with poor nutrition, alcoholism, and excessive GI or renal losses. Physiological adaptation. Question 266. A client with nasogastric NG tube begins vomiting. What action should the nurse take? A. Retape the NG tube. B. Clamp the NG tube. C. Remove the NG tube. D. Check the NG tube replacement. Answer D. Explanation. For the client with an NG tube who begins vomiting, the nurse should take the tube placement because it might be displaced, thereby leading to vomiting. The other responses are not appropriate. Reduction of risk potential. Question 267. Which of the following medications might cause upper gastrointestinal UGI bleeding? A. Cardism, B. naproxen, C. Elavil, D. Colgate. Answer B. Explanation. Naproxen might cause upper gastrointestinal UGI bleeding, reduction of risk potential. Question 268. When suctioning a client, what is the usual amount of time the nurse should spend for each suction pass? A. 2 seconds, B. 10 seconds, C. 20 seconds, D. 30 seconds. Answer B. Explanation. 10 seconds is the usual amount of time the nurse should spend for each suction pass. 2 seconds is not enough time to remove secretions. The remaining choices are too long and could lead to hypoxia and tissue trauma, reduction of risk potential. Question 269. Which of the following is the most appropriate diet for a client who is unable to swallow? A. Nothing by mouth. B. Nasogastric feedings. C. Clear liquids. D. Total parenteral nutrition. Answer B. Explanation. Nasogastric feedings are most appropriate for a client who is unable to swallow. Nothing by mouth leads to nutritional deficiencies. The client might aspirate a clear liquid diet. TPN is not necessary as long as the gut is still functioning. Reduction of risk potential. Question 270. An Asian family has an elderly member with late-stage Alzheimer's disease. The physician has recommended placement in a long-term care facility, but the family refuses. Which of the following is an appropriate response to the family by the nurse? A. You really need to listen to what the physician says. B. You will get too tired to take care of him at home. C. What can I do to assist you to care for him at home? D. You are too busy to be taking care of an elderly person. Answer C. Explanation. This is the only culturally sensitive statement. Many Asian cultures have a high respect for elders, and members of these cultures might not consider placement in a long-term care facility. This is because they feel it is more respectful for them to care for the family member at home. The nurse might be able to assist the family by determining what community resources are available to assist them. Reduction of risk potential. Thank you for watching.